What is sitting in your medicine cabinet right now? I mean the bottles you bought because the label said heart health, bone strength, memory support, better sleep, healthy aging. Are you taking something every morning because it sounds healthy? Because your neighbor swears by it? Because somebody online said it changed their life? Or because it just feels safer to take something than to do nothing? And here is the uncomfortable question. What if one of those supplements is not helping you at all? What if it is quietly raising your risk of bleeding, throwing off your blood pressure, straining your kidneys, interfering with your medication, or making you feel tired, foggy, constipated, dizzy, or just not like yourself? I want to tell you about a woman I once spoke with who was doing almost everything right. She was trying to age well, stay independent, protect her bones, protect her memory, and avoid more prescriptions. So she did what a lot of thoughtful people do. She built herself a little morning routine: calcium for bones, vitamin D because everybody talks about it, a memory supplement because she was forgetting names, garlic because somebody told her it was good for the heart, and a sleep aid at night because sleep had become frustrating. None of that sounded reckless. In fact, it sounded responsible. But then she started bruising easily. Her stomach felt off. She was more lightheaded when she stood up. And one of the most important parts of the story is this: she did not connect those symptoms to supplements. Most people do not. They connect side effects to aging. They say, well, I'm older now, maybe this is just what older feels like. And that is exactly how trouble gets missed. Because the truth is, your body changes with age. Your kidneys may not clear things as quickly. Your liver may not process things exactly the way it used to. You may be taking blood pressure medicine, a thyroid medicine, a heart medicine, a blood thinner, a diabetes medicine, a reflux medicine, or all of the above. And once you start layering supplements on top of medications, especially several at once, the chance of interactions goes up, and the chance of you getting clean feedback from your own body goes down. So this video is not anti-supplement. I want to be very clear about that. Some supplements are absolutely useful in the right person, at the right dose, for the right reason. But the phrase I want you to remember is this: helpful is not the same thing as harmless. That word natural tricks people. Natural does not mean gentle. Natural does not mean safe for your kidneys. Natural does not mean safe with your heart medicine. Natural does not mean safe before surgery. And that is why, in this video, I'm going to walk you through the supplements seniors should not take blindly, casually, or automatically before understanding what they actually do in a real body with real medications, real blood pressure, real kidneys, and real risks. Some of these might surprise you because they are common. Some are sold like wellness products when they behave more like low-grade drugs. And some are only dangerous in certain situations, which is why nuance matters so much. Before we get into the list, I need you to understand the bigger pattern. When I worry about supplements in older adults, I am usually thinking about 5 things. Number 1, bleeding. Number 2, kidney strain. Number 3, changes in calcium or potassium that can affect the heart. Number 4, medication interactions that make a prescription weaker or stronger. And number 5, false reassurance, where a person feels like they are treating a problem but never checks whether they even needed treatment in the first place. That last one matters more than people think. Because once you start taking something, you stop being curious. You say, I'm taking iron, so I must have low iron. I'm taking vitamin D, so I must have needed it. I'm taking magnesium, so it must be good for me. But your body does not care about your intention. Your body responds to dose, timing, interactions, and physiology. And that means a supplement can be a smart tool in one person and a bad idea in the next person sitting right beside them. All right, let's start with one that gets a free pass far too often, and that is iron. Seniors, please do not start taking iron just because you feel tired. Do not take it because a multivitamin for younger women used to contain it and you kept buying the same thing. Do not take it because your friends said low iron is common. Iron is one of those supplements that is wonderful when you truly need it and a bad guest when you do not. Here is why. Iron can cause stomach upset, nausea, abdominal pain, constipation, dark stools, sometimes diarrhea, and in higher amounts, it can irritate the stomach more seriously. And if you are older and already dealing with sluggish bowels, hemorrhoids, bloating, reflux, or unpredictable appetite, adding iron without a true reason can make your day-to-day life worse very quickly. Then people start taking another pill for the constipation caused by the first pill, and now the spiral begins. But the bigger issue is this: tiredness is not a diagnosis. Fatigue can come from poor sleep, low protein intake, thyroid problems, dehydration, depression, heart disease, medication side effects, low B12, grief, blood sugar swings, or simply doing too much for a body that is asking for better recovery. If you jump straight to iron, you can miss the real problem. And if you happen to have a condition that causes iron overload, taking extra iron is not just unnecessary, it can be harmful. And here's another detail most people miss. Iron can interfere with the absorption of other medicines. If you take thyroid medication, there is a timing issue. If you take certain Parkinson's medications, there can be an absorption issue. If you take calcium at the same time, that can also complicate absorption. So iron is not a casual supplement. It is a targeted supplement. If your doctor says you are iron deficient, great, now we have a reason. Otherwise, do not self-diagnose with iron. Next is potassium, and this one is a quiet landmine. People hear potassium helps blood pressure, potassium is good for muscles, potassium is important for the heart, and all of that is true. But some seniors should be extremely careful with potassium supplements, and even with salt substitutes that contain potassium. If your kidneys are not clearing potassium well, or if you are on certain medications, potassium can build up in the blood, and that can become very dangerous. I want you to hear this clearly. If you have chronic kidney disease, heart failure, diabetes, liver issues, or adrenal problems, potassium is not something to play with. And if you take an ACE inhibitor, an ARB, or a potassium-sparing diuretic like spironolactone, you need extra caution. People think the danger is only with giant supplement doses, but sometimes the problem is the combination: a supplement, a salt substitute, a medication, and kidneys that are no longer clearing as efficiently as they used to. The scary part is that high potassium does not always announce itself dramatically at first. Sometimes it shows up as weakness, a strange heavy feeling, fatigue, palpitations, or just feeling unwell. Sometimes it is caught on labs before symptoms become obvious. That is why potassium is one of those things I really prefer people get from food when appropriate, not from random capsules they bought because the label said heart support. Food behaves differently. Concentrated supplements demand more respect. Now let's talk about calcium, because this one confuses a lot of older adults. People are told from every direction to protect their bones, so they buy calcium, maybe a lot of it, maybe more than one product with calcium in it, maybe calcium plus vitamin D, plus a multivitamin, plus fortified drinks, and before they know it, they are stacking dose on dose without realizing it. The intention is good, the execution is often sloppy. Calcium is important, but high-dose supplemental calcium is not automatically better. Some people get bloating, gas, and constipation, which in older adults can become a miserable daily issue. Some forms are absorbed differently, especially if stomach acid is lower. And there is also concern in the research about higher supplemental calcium being associated in some situations with kidney stones and cardiovascular risk. That does not mean calcium is evil. It means you should know why you are taking it and how much total calcium you are really getting. This is where people get into trouble. They treat bone health like it lives in one bottle. But bone is not just calcium, it is movement, muscle strength, protein, vitamin D status, balance, sunlight, medication review, fall prevention, sleep, and yes, sometimes targeted supplementation. If you are swallowing calcium but not resistance training, not eating enough protein, and not reviewing your fall risk, then you are focusing on the easiest part and ignoring the most powerful parts. And right beside calcium sits vitamin D, probably the most casually overused supplement in modern wellness. Now, many older adults do benefit from vitamin D, especially if labs are low or sun exposure is limited. But more is not automatically better. Very high vitamin D intake can push calcium levels too high. And when calcium goes too high, people can get nausea, weakness, poor appetite, thirst, more urination, dehydration, kidney stones, and in severe cases, kidney damage and heart rhythm problems. What makes vitamin D tricky is that people assume it is gentle because it is a vitamin. They say, well, I'm just supporting my immune system, supporting my bones, supporting healthy aging. But if you are already taking calcium, and then you add vitamin D, and then your diet is high in fortified foods, and then you take another combination bone supplement, you can create a situation you never intended. This is why labs matter. This is why dose matters. And this is why your supplement list should be reviewed like a medication list. Right around the middle of this conversation, let me say this exactly once. If this is helping you protect your health, please subscribe, like this video, and stay with me for more guidance. All right, let's keep going because the next one is vitamin E. And seniors really need to stop assuming vitamin E capsules are harmless. Vitamin E is essential in the diet, yes, but high-dose vitamin E supplements are a different conversation. In supplement form, higher doses can increase bleeding risk. That matters even more if you are taking a blood thinner, aspirin, or an antiplatelet medicine. And if you have surgery coming up, this is not something you want to discover by accident at the wrong time. The reason this one bothers me is because vitamin E still carries a health halo. People think antioxidant, so it must be protective. But more antioxidant activity in a capsule does not automatically translate to better health in a human body. In fact, some research has raised concern about harm with supplemental vitamin E in certain situations, including increased bleeding risk and even hemorrhagic stroke. And that is the pattern I want you to notice in this whole video. When dose gets concentrated, the risk profile changes. If you are older and on a blood thinner, this is where you have to stop being casual. Because when bruising starts, or nosebleeds happen more easily, or a cut seems to bleed longer than it used to, people rarely think, maybe it's the supplement. They think, I'm just getting older. No. Sometimes that is your body giving you feedback. And I would rather you listen to quiet feedback now than wait for a dramatic event later. Next comes ginkgo, the classic memory supplement. I understand the appeal. Memory changes are scary. Word finding can be scary. Misplacing things can be scary. And if somebody offers you a bottle that promises circulation and brain support, it is very tempting. But ginkgo is not a free trial for your brain. It can interact with medications, and one of the biggest concerns is bleeding, especially if you are taking anticoagulants, antiplatelet medicines, or other products that also affect clotting. And this is the emotional trap with memory supplements. People feel urgency. They say, I have to do something now. But urgency makes people less skeptical. It makes them accept weak evidence and ignore strong warnings. I am not telling you never to ask about memory support. I am telling you not to reach for ginkgo casually, especially if you already have a complicated medication list. Your brain does matter. which is exactly why we do not throw unreviewed supplements at it. Another one people underestimate is garlic supplements. I'm not talking about cooking with garlic in your food. I'm talking about concentrated garlic capsules sold for cholesterol, blood pressure, or heart support. Some evidence suggests a small benefit in certain people, yes, but garlic supplements can increase bleeding risk. So if you take aspirin, anticoagulants, or you have surgery or a dental procedure coming up, that matters. And the people most likely to be using heart-related supplements are often the exact people who are already on heart-related medications. This is a great example of how good intentions create stacking effects. A person says, I'm on a blood thinner, but I want to do something natural for my heart too, so they add garlic. Then maybe fish oil, maybe vitamin E, maybe turmeric from another product, and every single bottle sounds mild on its own. But your body experiences the pile, not the marketing. That is how risk accumulates in real life, not usually from one outrageous decision, but from several reasonable-sounding ones layered together. Now let's talk about St. John's wort. And this one is a major problem because it interacts with a shocking number of medications. People often reach for it because mood changes, loneliness, grief, stress, and mild depressive symptoms are common in older adults, especially after retirement, illness, pain, or loss. And because it is sold without a prescription, people assume it is simpler and safer than standard medication. But St. John's wort can reduce the effectiveness of many medicines by speeding up how your body breaks them down. That means your other medications may stop doing the job you think they are doing. Heart medicines, certain statins, digoxin, warfarin, some antidepressants, some immune medications, even more than that. And if combined with certain antidepressants, it can also increase the risk of too much serotonin, which is not something to take lightly. This is one of the worst supplements for somebody who is older, taking multiple medications and trying to self-manage a mood problem without full review. And I want to say something gently here. Sadness, low motivation, poor sleep, and loss of interest deserve real attention. But that does not mean the solution is a supplement with a complicated interaction profile. Sometimes the real need is therapy, social support, grief work, exercise, medication review, pain control, or treatment for sleep apnea, anemia, thyroid disease, or depression itself. When you numb your concern with a supplement before getting clarity, you may delay the help that would actually change your life. Let's move to magnesium, because this one is both useful and overused. Magnesium gets recommended for everything now: sleep, blood pressure, constipation, anxiety, leg cramps, migraines, relaxation, muscle tension, and healthy aging. And yes, magnesium can absolutely be helpful in the right setting, but too much supplemental magnesium can cause diarrhea, abdominal cramping, and nausea. And if a senior already has fragile hydration status, those side effects are not a minor inconvenience. They can tip somebody into dizziness, weakness, or dehydration. Magnesium also has a timing problem with other medicines. It can interfere with the absorption of certain antibiotics and certain osteoporosis medications if taken too close together. And many people do not realize their antacid, laxative, or sleep powder already contains magnesium. So they buy a second magnesium product, and now they are doubling or tripling up without realizing it. If you are taking magnesium and your stools suddenly change, or you feel more wiped out, look at the bottle before you blame age. I also want to talk about vitamin A, especially preformed vitamin A in higher dose supplements. This one hides in multivitamins, eye formulas, immune products, skin products, and cod liver oil type products. Too much preformed vitamin A can cause headache, dizziness, nausea, blurred vision, and coordination problems. And older adults are already more vulnerable to falls, balance issues, and medication side effects. So anything that adds more dizziness or instability deserves respect. Also, some evidence suggests excess vitamin A may reduce bone strength, which is the opposite of what most seniors want. And if you or someone you love has a history of smoking, there is another important nuance. High-dose beta-carotene supplementation has been linked in certain groups, especially smokers and former smokers, to increased lung cancer risk. So when people say, "Oh, it's just an antioxidant blend," I want you to stop and actually read what is in it. Because not every antioxidant formula is automatically wise, and not every vision or healthy aging product is designed with your individual risk in mind. Now let's talk about the supplement that people do not always recognize as a supplement, and that is the extra sleep stack. Melatonin, calming blends, magnesium powders, herbal sleep gummies, nighttime teas, all layered together because sleep is hard and exhaustion makes people impatient. I understand that, truly. But if you are a senior and you already feel a little groggy in the morning, a little unsteady walking to the bathroom at night, a little foggy after breakfast, piling on sleep products may worsen the very independence you are trying to preserve. This is less about one single ingredient being evil, and more about the pattern of sedating yourself in fragments. One product for relaxation, another for deeper sleep, another because you still woke up at 3 in the morning, and then suddenly your nights are not much better, but your days are worse. More fatigue, more brain fog, more naps, less movement, worse nighttime sleep, and now you have created a cycle. When sleep is off, review caffeine, alcohol, reflux, pain, light exposure, medications, and sleep apnea risk before building a supplement tower. Another category that deserves caution is the bone and joint mega combo. You know the ones. They contain calcium, vitamin D, magnesium, maybe boron, maybe extra vitamin A, maybe herbs, maybe other minerals, all in one aggressive formula. People like them because it feels efficient. One product, one decision, one promise. But complex combination products make it harder to know what is helping, what is not helping, and what might be causing side effects. If you get constipated, nauseated, lightheaded, or your labs shift, which ingredient did it? And this is why I usually prefer clarity over complexity. If you need something, I want to know what it is and why you are taking it. Not just because simplicity is easier, but because it is safer. Older adults do better when the plan is clean. Clean plan, clean reason, clean dose, clean follow-up. Once you start taking combination products for every vague fear of aging, you no longer have a plan. You have a supplement collection. I also need to warn you about taking multiple products that all claim heart support. This category is full of overlap. Garlic, fish oil, vitamin E, herbal circulation blends, red powders, antioxidant mixes. One may slightly affect bleeding, another may slightly affect blood pressure, another may slightly affect stomach tolerance, and together they create a real physiologic effect, even though each one was marketed as gentle. That overlap is especially risky if you have atrial fibrillation, coronary disease, prior stroke, or you already take aspirin or prescription blood thinners. This is how people accidentally medicate themselves twice. Once with a prescription, and once with a supplement strategy that was never reviewed as a full system. And I want seniors to think like this. Every bottle is entering the same bloodstream, the same kidneys, the same liver, the same nervous system. Your body does not divide things into doctor pills and natural pills. That is a marketing distinction. Your body only sees compounds, doses, timing, and interactions. There is another supplement behavior that worries me, and it is the emergency reaction purchase. Somebody gets one bad blood pressure reading, one cramp, one poor night of sleep, one memory lapse, one bruise, one article online, and by that afternoon, they are ordering 3 supplements. That is not a plan. That is panic shopping. And panic shopping is a terrible way to manage an aging body because older physiology rewards consistency, observation, and precision, not scattershot experimentation. If something changed in your health, your first question should not be, "What can I buy?" Your first question should be, "What changed?" Did your sleep change? Did your hydration change? Did you start a new medication? Did your diet shift? Did your walking decrease? Are you eating less protein? Did you stop strength training? Are you more stressed? Did you lose weight unintentionally? Is your blood pressure lower? Is your blood sugar higher? That kind of curiosity protects you much more than a supplement impulse ever will. So, what should seniors actually do before starting any supplement? I want to make this extremely practical. First, write down every prescription, over-the-counter drug, vitamin, mineral, herb, gummy, tea, powder, and as-needed product you use. All of it. Not in your head, on paper. Second, next to each one, write why you take it. If you cannot explain the reason clearly in one sentence, that is a clue. Third, circle anything you started because somebody said it was good for everyone. There is no such thing. Fourth, check whether you are duplicating ingredients. Calcium in one bottle, calcium in another. Vitamin D in 3 things. Magnesium in your sleep powder and your constipation remedy. Vitamin A in your multivitamin and your eye formula. This happens all the time. Fifth, think about your medical context. Kidney disease, heart rhythm issues, blood thinner, osteoporosis medicine, thyroid medicine, Parkinson's medicine, chemotherapy, upcoming surgery. Those details change everything. The right supplement in one context becomes the wrong supplement in another. And number 6, this is so important. Test outcomes, not hopes. If you take iron, was iron low? If you take vitamin D, what was the level? If you take calcium, how much are you already getting from food? If you take magnesium for cramps, did it actually help? If you take a memory supplement, is there a measurable improvement or just a feeling that you are doing something? Because doing something and helping something are not the same event. I also want seniors to stop feeling embarrassed about asking their doctor or pharmacist to review supplements. Please do not minimize it by saying, "Oh, it's just vitamins." Your healthcare team would much rather know now than after a lab abnormality, a bleeding episode, a fainting spell, or a medication failure. And pharmacists in particular are often excellent at spotting interactions people never would have considered. Bring the bottles, take pictures of the labels, make it easy to review. And if you are caring for a parent or spouse, you may need to do a supplement audit at home. Open the cabinet, check the nightstand, look in the purse, look by the recliner. Sometimes one person is taking 2 versions of the same thing from different brands because the labels look different. Sometimes the person stopped the prescription but kept the supplement. Sometimes they kept the prescription and added the supplement that was supposed to replace it. This is not rare. This is everyday life. The bigger message here is not fear. The bigger message is respect. Respect for the fact that aging changes physiology. Respect for the fact that one little bottle can have a big effect in the wrong body. Respect for the fact that symptoms like dizziness, bruising, constipation, nausea, brain fog, palpitations, weakness, and sleepiness deserve curiosity, not dismissal. And respect for the fact that you can absolutely support healthy aging without turning your morning routine into a chemistry experiment. If I had to summarize the supplements I most want seniors to stop taking blindly, it would be these: iron without proof of deficiency, potassium without medical guidance, high-dose calcium without reviewing total intake and kidney stone risk, high-dose vitamin D without checking labs, vitamin E when bleeding risk is already on the table, ginkgo for memory without reviewing blood thinners, garlic capsules without reviewing surgery or clotting risk, St. John's wort with almost any medication list, and magnesium without respecting dose and timing. Those are not the only ones, but they are big ones. And let me end with this. If a supplement is truly right for you, it will survive scrutiny. It will survive a medication review. It will survive dose checking. It will survive lab checking. It will survive the question, why am I taking this? Good care is never threatened by clarity. Only bad habits are. So before you swallow the next capsule because the bottle said healthy aging, slow down. Make sure it fits your body, your labs, your medications, and your actual problem. Because the goal is not to take more things. The goal is to feel better, think clearly, stay steady on your feet, protect your heart, protect your kidneys, protect your independence, and make choices that are working with your body instead of quietly against it.